Hello everyone, this class will be an introduction to cardiovascular system. The learning objectives will be to correlate the functional histology of vessels, that is different layers in different blood vessels with their function. Give the functional classification of blood vessels and give their functions with examples. Name different parts of vascular system and give their functions. Appreciate the difference between systemic and pulmonary circulations. Understand the importance of central and peripheral blood volumes. CVS transports essential nutrients, oxygen, hormones to the tissues and removes the products of metabolism from the tissue and also contributes to the regulation of many homeostatic functions. These functions are carried out by altering the amount of blood pumped and changing the caliber of the vessels. It performs efficiently to meet the usual challenges of day-to-day activities. It consists of central pump, the heart, and extensive network of blood vessels. Central pump, the heart. The primary function of the heart is to pump the blood. The heart consists of a dual pump, that is right and left pumps. The right pump, that is the right ventricle, propels the blood into the pulmonary circulation, and the left pump, that is left ventricle, propels the blood into the systemic circulation. The output of each pump at rest is about 5 liters per minute. Output increases many-fold in daily routine activities, exercise, and emotions. Heart has 4 chambers, 2 atria and 2 ventricles. The right side of the heart consists of right atrium and the right ventricle, and the left side of the heart consists of left atrium and left ventricle. So this diagram shows the systemic circulation and the pulmonary circulation. From the heart, the blood goes to the systemic circulation, and from the systemic circulation it reaches the right ventricle, and from the right ventricle it goes to the pulmonary circulation, that is right or left lung. So then it goes to the oxygenated blood goes to the left ventricle through left atrium. From there the blood is pumped to the aorta to go to the systemic circulation. The right side of the heart, the right atrium and the right ventricle. The right atrium receives the blood from the body through superior and inferior vena cava and empties blood into right ventricle. The right atrioventricular wall or tricuspid wall guards the flow of blood from the right atrium to right ventricle and prevents blood flow in the backward direction. The right ventricle pumps blood into pulmonary circulation through the pulmonary trunk, that is pulmonary arteries, where gaseous exchange takes place. The pulmonary wall prevents backflow of blood from pulmonary trunk into the right ventricle. The left side of the heart, that is left atrium and the ventricle. The left atrium receives oxygenated blood from the pulmonary circulation via pulmonary veins and empties into the left ventricle through left atrioventricular wall or mitral wall. The mitral wall ensures unidirectional flow of the blood from left atrium into the left ventricle. Left ventricle pumps blood into systemic circulation through aorta. The aortic or semilunar wall, which is present at the base of the aorta, prevents backflow of blood into left ventricle from aorta. So this is the diagram which is showing from the superior vena cava, blood enters into the right atrium, then the blood enters into the right ventricle through the tricuspid wall, which prevents the backflow of blood back into the right atrium. So then from right ventricle it is going to go to the pulmonary artery, where the pulmonary wall is going to prevent the blood from entry back into the right ventricle from the pulmonary artery, whereas left atria receives blood from the left pulmonary veins and the blood enters into the left ventricle through the mitral wall. So then the blood is going to enter into the aorta through another semilunar wall, that is aortic wall. The blood vessels. The blood from the left ventricle is pumped into systemic circulation. Blood from right ventricle enters pulmonary circulation The systemic arteries branched and thicker than the pulmonary arteries. Therefore, systemic circulation provides more resistance to the blood flow. Left ventricle pumps the blood at much higher pressure. The peak left ventricular pressure is 120 mm of Hg. The peak right ventricular pressure is 25 mm Hg. Okay. So this diagram showing uh, the arterial and venous system. The oxygenated blood goes to the head and neck and arm arteries as well as into the different parts of the body like hepatic artery, uh, then the pelvis and leg artery, then to the renal circulation. Then the capillaries, they get converted into the venous channels, that is which carry deoxygenated blood. It is going to enter back into the right ventricle through right atria. Functional histology of blood vessels. The blood vessels have three layers. Tunica externa, that is adventitia, consists of elastic tissue and collagen fibers. Tunica media consists of smooth muscle and elastic tissues. Contraction causes vasoconstriction and relaxation causes vasodilatation. The tunica interna, that is intima, consists of endothelial lining. This is the diagram showing different layers of tunica adventitia, which is outer, tunica media, middle layer, and tunica intima, most internal layer, which consists of endothelial cells. Endothelial cells, elastic tissue, smooth muscles, and fibrous tissue. So these are the different components of the blood vessels. Endothelial cells form inner lining of the blood vessels or vascular endothelium. It present as a single continuous layer. In capillaries, the vessel is formed by only a layer of endothelial cells present on the basal lamina. This makes them suitable for exchange of substances between blood and tissues. It secretes many chemicals and hormones. The elastic tissue. The amount of elastic tissue present in the vessel wall determines the ability of a vessel to stretch. It is made up of elastins and myofibrils. Elastins, the protein molecules formed by nonpolar amino acids. Myofibrils, they are minute fibril strands made up of glycoproteins. Elastic fibers, they are abundant in arteries and veins and less in arterioles and are absent in capillaries and venules. Smooth muscle is present in all the vessels except capillaries and venules. Fibrous tissue present in the blood vessels. The fibrous tissue is made up of collagen fibers, mainly type 1 and type 3 collagen. It is present in all parts of vascular tree except capillaries. It prevents distensions of vessels and increases wall tension. Physiological classification of blood vessels. They are classified into Wind-Kessel vessels, resistance vessels, exchange vessels, and capacitance vessels. Wind-Kessel vessels, they are larger arteries, aorta, and they have more elastic elements in their wall. Therefore, these vessels have higher compliance. During systole, their wall stretches, and during diastole, their wall recoils back. So this recoiling effect is called as Wind-Kessel effect. Resistance vessels are arterioles, metaterioles, and smaller arteries. They have a thick muscle coat and less elastic fiber in their wall. Therefore, they provide resistance to flow of blood. The maximum resistance to flow is offered by arterioles. Thus, arterioles form a major seat of peripheral resistance. Exchange vessels. Capillaries are thin vessels and they are called as exchange vessels. The blood flow is sluggish in capillaries. These two factors, that is thin wall and sluggish flow, favor exchange of gases and nutrients along the capillary wall. Therefore, capillaries are also called as exchange vessels. The capacitance vessels. Veins can accommodate larger amount of blood without increasing much pressure in them. Therefore, large and small veins are called as capacitance vessels. Divisions of vascular system. The arterial system, system of capillary network, and the venous system. So it has been divided into three. Arterial system consists of aorta, large arteries, small arteries, arterioles, and metaterioles. The function is to deliver the oxygenated blood from lungs to the tissues. Arteries it has a thick tunica media innervated by sympathetic fibers resulting in vasoconstriction. The arteries are susceptible to atherosclerosis, a process in which there is a formation of atheromatous plaque on the lumen of the blood vessels. Pathological atherosclerosis reduces the blood flow to the organs and causes myocardial infarction and stroke. Arterioles, they're nothing but the arteries that branch out from the arterioles. It regulates the resistance to flow, thus they control distribution of rate of blood flow to the organs. It has a thick muscle coat and few elastic fibers in their wall. The ratio of thickness of wall to the diameter of the vessel is high in arterioles. Hence, arterioles are the main resistance vessels and they serve as a stopcock for the circulation. Atherosclerosis of arterioles is called as arteriosclerosis. Metaarterioles. Arterioles terminate in metaarterioles. Metaarterioles are histologically same as that of arterioles except that the muscle coat is thin and the lumen is smaller. A flap of smooth muscle called as a precapillary sphincter is present at the end of metaarterioles or arterioles. This sphincter regulates the blood flow to the capillaries. System of capillary network. The capillaries originate from the arterioles and metaarterioles. The flow of blood is slow in capillaries that favor exchange of materials. Capillaries connect the arterioles to venules. It is made up of single layer of endothelial cells. Capillaries are therefore called as exchange vessels because of the thin walls. Microcirculation is the circulation of blood through the capillaries. There is no smooth muscle in capillaries. Therefore, constriction or dilatation of capillaries is regulated by precapillary sphincter. However, capillaries do constrict directly due to the presence of pericyte and few myosin-like filaments in their walls. Venous system. It consists of collecting venules and small and large veins. Their function is to collect, store, and deliver blood to the atria. The collecting venules originate from capillaries and drain into venules that in turn into the veins. The larger veins finally drain into the atria. The delivery of blood to the atria is called as venous return. Venules, the mini capillaries unite to form venules. The function of these venules is to collect blood from capillaries and drain into the veins. They are innervated by sympathetic fibers. Veins. Venules unite to form veins that join together to form larger veins. Veins have thin muscle coat. About 2/3 of blood volume in the systemic circulation is present in veins. Therefore, veins serve as the blood reservoir. The veins in the limbs, especially in the lower limbs, contain walls within. Venous walls facilitates venous return. Venous return also assisted by contraction of the skeletal muscles of the limb in which the veins are located. Systemic circulation. The circulation of blood through systemic vascular bed is called as systemic circulation. This is also called as peripheral circulation or the greater circulation, which contains 80 to 85% of the total volume of blood. It provides oxygenated blood to different parts of the body and drains venous blood back to the heart. The left ventricle pumps the blood into the systemic circulation. The pressure in the systemic circulation is high. The systolic pressure is around 100 to 140 mmHg. The pressure drops progressively as the blood flows from arteries to the veins. The arteries and arterioles have high resting vasoconstrictor tone. Thus, they provide greater resistance to blood flow. The capillaries are larger and narrower. Therefore, systemic capillaries also provide resistance to the flow. Coming to pulmonary circulation, the circulation of the blood through the pulmonary vascular bed is called as pulmonary circulation. This is also called as central circulation or lesser circulation, which contains only 10 to 12% of the total blood volume. It provides a low resistance path for the entire output of the right ventricle to traverse through the lungs. The function of this pulmonary circulation is to exchange gases between the blood and the atmosphere. The arteries have thin wall and larger lumen and also rich sympathetic innervation, but lack resting vasoconstrictor tone. The arterioles have thin wall and larger lumen. Therefore, pulmonary arterioles provide low resistance to flow. The capillaries are shorter and wider. Consequently, resistance is also less in capillaries. The vessels in the pulmonary circulation provide a low resistance circulation. Equal amount of blood is ejected by right and left ventricle, but the right ventricle pumps the blood into much smaller compartment, the pulmonary circulation. So these are some of the difference between systemic circulation and pulmonary circulation. So they are called as peripheral or greater circulation and central or lesser circulation respectively. The pressure is high in systemic circulation where it is called as low pressure system. The pressure ranges between 100 to 40 here and 20 to 30 here in pulmonary circulation. Diastolic pressure is between 60 to 90 and here it is 5 to 15. The mean pressure is 100 and 15 mmHg respectively. Pulse pressure is 20 and 10 to 15 mmHg respectively. The arteries in systemic circulation, they are thick wall and narrow lumen, whereas in pulmonary circulation, they have a thin wall and large lumen. Arterioles are thick wall and narrow lumen, whereas in pulmonary circulation, they are thin wall and large lumen. Capillaries here are long and narrow, here they are short and wide. The resting sympathetic tone is high in systemic circulation where it is absent in pulmonary circulation. Peripheral resistance is high in systemic circulation, it is low in pulmonary circulation. Capillary blood is continuous and in systemic circulation and it is pulsatile in pulmonary circulation. So this is a brief introduction to the cardiovascular system. Thank you.